So I want to say a big welcome to our attendees for this year's web series. We have the Hyperemesis gravidarum in focus today, also known as pregnancy sickness or morning sickness, as some of you might have heard about it. So today we have a wonderful panel of people with lived experience and professional experience. Some of you might be aware that I am a 5-time sufferer of hyperemesis myself. So this is a topic that I'm particularly passionate about. Most of you know me, I'm Natasha Smith, the founder and managing director of the Women's Health and Maternal Wellbeing Initiative. I'm going to hand over to my panelists today and they will introduce themselves. So Ria, would you like to go first and introduce yourself?
Sure. Hi everyone, my name is Dr. Ria Clark and I am a registrar in obstetrics and gynecology, which is a doctor who's training to be a consultant. And I've experienced severe hyperemesis in 2 pregnancies.
Thank you, Ria. And Amanda?
Hi everybody, my name's Amanda and I am the CEO and founder of Maternity Engagement Action, supporting Black perinatal women in Birmingham and the West Midlands, and I am a HG survivor.
Thank you, Amanda. Dr. Caitlin, could you introduce yourself?
Hi, yeah, I'm Dr. Caitlin Dean. I'm actually a nurse by background, but I got my PhD in hyperemesis research. I've specialised in it since suffering with it in my own 3 pregnancies as well.
Thank you. And Rachel, could you introduce yourself?
Hi, I'm Rachel Wellbeing. I'm the founder of Mummies Day Out and HD Support for All, and I am a 3-time sufferer of HG, and I have 2 beautiful children and 1 bonus child.
Thank you, Rachel. So to start, we are going to just kind of explore what is HG, pregnancy sickness, morning sickness. Dr. Ria Clark, would you be able to provide us with an explanation and clarify the kind of differences or misunderstandings between, morning sickness and hyperemesis?
Sure. So there is a spectrum of pregnancy sickness or nausea and vomiting, and it's something that most people who are pregnant will experience at some point, and it's commonly called morning sickness. So you may get people that feel a little bit queasy and then they're sick, then they feel a bit better, go about their day. Hyperemesis is the extreme end of that spectrum, and it's characterized by severe nausea, severe vomiting, weight loss. And unlike nausea and vomiting of pregnancy, which can be quite mild and can dissipate, when hyperemesis sets in, it can be very, very severe. For some people, it can last the duration of their pregnancies, often requires medication, may require hospital admissions. And it is not a mind over matter thing. It's not a just focus on being happy about your baby and your pregnancy. It's something that completely takes over your existence, which I know I'm preaching to the converted, but for anybody out there who doesn't know what hyperemesis is like, it's worlds away from what you can imagine morning sickness to be.
Absolutely. Yeah, I agree with you. I don't know if anyone else wants to add to Dr. Ria's explanation or, just kind of second that in any way.
I suppose I would like to say that it's people think of it as just the nausea and vomiting, but there's sort of so much more about it that's also incredibly debilitating, like the very excessive saliva you can produce because you're constantly on the verge of vomiting, and the loneliness and isolation from being bedbound and housebound for months on end at a time when you thought you were going to be sort of excited and going to maternity classes and shopping for your new baby and all this, and actually you're just completely and utterly debilitated. So it's very common also to get sort of depression and other things alongside it, and dehydration can then end up, you can be constipated and have headaches and fatigue that is overwhelming. So it's I guess it is slightly more even than just as if the severe nausea and vomiting wasn't enough. There's like all this other horrific stuff around it as well.
Yeah, definitely. And I know that probably as we all talk, we're going to be sharing different elements of what that looked like and felt like for us. So I could go on with lists and lists of things and symptoms, you know, that I remember experiencing, but I'm not going to do that. What I would love to do is just to hear more about, Dr. Ria, your experience of HD, because I know that you have a personal experience as well, and quite interested to hear about that in the context of you also being a healthcare professional. For a lot of people, they don't know that HD is HD. They might think that they have morning sickness, and they're often also told that it's a sign of a healthy pregnancy, particularly if it's like your first pregnancy, and if you're still in the kind of first trimester, that, oh, it's, don't worry, you know, you're healthy, it's a great sign. Your baby's healthy, and actually, you know, you're really suffering. So yeah, I'd love to hear about your experience of HG.
So my first ever experience of HG was actually when I was at medical school, and we had to choose a patient to do a case study about. And you could either focus on the psychosocial aspects of a patient's condition or the physiology of it, for example. And I was doing my first ever obs and gynae placement, which is where I fell in love with the specialty. And I met a woman who was in the first trimester of her pregnancy. It was her second pregnancy. She'd had hyperemesis in the first. And she was grey. She was a complete shell of a person. She could barely speak. She couldn't make eye contact because it felt too difficult. She was an Asian woman, and I think the thing that got me was, one, her how distressed she was and how unwell she was, but it was also the reaction of the staff, how indifferent they were towards her, how uncaring they were towards her, that the attitude was that she was a malingerer, that she just wasn't trying hard enough, that she was being really precious. And even as a medical student, I was just like, this is, sorry to use a swear, I was like, this is bullshit. How can they treat her like this? This is disgusting. Yeah. So in this essay, I was very critical of the care that she received. And I got a good mark, but the feedback was, needs to be more understanding of what it's like to be a healthcare professional. And it was quite condescending. And I remember being absolutely irate about the feedback. And I was like, I'd rather get a D and say it with my chest than get nice feedback. But this, you know, I was really angry about it. Yeah. And my best friend at the time said to me, wouldn't it be ironic if you got hyperemesis one day? And, you know, then we forgot about it. My first pregnancy, my son was a honeymoon baby. So for those first few weeks before the hyperemesis kicked in, it was blissful. We'd just come back from Mexico. I was relaxed, I was happy. Actually, that's a lie, I wasn't relaxed because I'm an obs and gynae doctor and I was paranoid all the time, but I didn't feel sick as such. I was just, you know, doing everything everybody else does. I had the app, I was looking at what fruit my baby was. I remember the first time I was sick because I'd just come out of handover at work and I ran to the loo, I was sick and then I felt better. And I was like, oh, okay, baby's bedding in, that means stuff's happening, cool. But within 48 hours, I couldn't move because I was vomiting so much. Managed to get an out of hours appointment at the GP. And the GP said, well, what do you mean you're allergic to all these antiemetics? You can't be. You can't have ondansetron, it's too expensive. And you're only 7 weeks, so if you have that, it will damage the baby. And I was like, well, I know from work that that's not true. And you can see that, you know, I don't look very well. You can see my blood pressure is really low. So what do you want me to do? Okay, I'll give you 5 ondansetron, but that's it. And that was the start of me being on the other side of it, having seen how women with hyperemesis were treated as an obs and gynae doctor. I knew that I was going to have a fight on my hands. But when you've got a fight on your hands and you don't have the strength to move, advocating for yourself was just so difficult. When I finally got admitted, my best friend turned up at the hospital, and I was so lucky that she was able to advocate for me because she knew me well enough to know that I couldn't. And she was a doctor, so she just turned up, got my drug chart, went up to someone and said, you're admitting her, but she doesn't have any fluids. What's all that about? Where's this? Where's this? I had to coordinate my own care because nobody was interested in me. So on my third day of being admitted, I had to bleep the on-call pharmacist myself from a hospital bed. And they came to see me, and we found a paper on the internet that talked about steroids, because by then I'd lost over 10% of my body weight and was on IVs, but still wasn't keeping anything down. So we found a paper from Newcastle about steroids. And when a senior finally decided that they would come and see me on day 5 of my admission, I said, can I try this? And they went, oh, we've never done it before, but yeah, I guess so. And that's how I got stable during that pregnancy. But I was sick for the whole pregnancy. I was off work until the 3rd trimester, forced myself back to work, and then rebounded back in hospital, because the one thing about hyperemesis is if you don't rest, it will take you down. It's going to take you down anyway, but if you don't rest, it will do it quicker. It was a lot. Second pregnancy was even worse, despite knowing everything, despite doing everything right. And I say second pregnancy, it was my second child, not my second pregnancy. But it was horrific. And that's something that everybody who's had hyperemesis more than once will know, that balance between wanting to grow your family and being too scared to. And I know I'm not alone in that, so I'll hand over to you guys and let other people share.
Thanks so much, Ria, for sharing. And I know that it's really hard to share a hyperemesis experience because it's so raw. Like, no matter how far you are from that pregnancy, it's just such a raw experience that, because it's so lonely, so I say it's so debilitating, like you said, if you're not resting, like that is literally the cue for your body to just start tormenting you. You know, so I completely understand that. Do you feel like because at any point, and you know, this might not be the case at all, but do you feel like at any point there was like an advantage that you had in being a healthcare professional to kind of navigate the kind of care pathways or the treatments? Because one thing that I found with hyperemesis, even for sufferers, is that they often don't know that it's treatable. They don't know, for example, that there's more than one medicine that can be tried. So I remember with my first pregnancy, I was given, I think, cyclosine, and it just didn't agree with me, and I just didn't take it. And so I just thought I'll just suffer for the rest of the pregnancy, which I did. And I had 3 pregnancies in which I was unmedicated for, because I just felt like there was only one choice. And then I have 3 children. I've had 5 pregnancies, so people can do the maths for that as well. And then the 4th one, I was just so completely sick that they needed to try me on several medications. But the only reason I knew that I could try more was because I had then grew my birth community, because I'm obviously working in the birth field, and I had so many people say, this is what you need to do. This is exactly what you need to do. These are the people you need to speak to. These are the numbers. These are the websites. And within the organizations, they were like, Natasha, you can have this. Tell them you should be doing this. It was like I had to literally, like you said, I had to take control. But I was at an advantage 4 pregnancies later with all these people around me supporting me. Is that in any way similar to you, or no, that was, you know, not true for you, you know? Yeah, tell me, please.
Yes and no. I was pregnant when the Green Top guidelines came out in 2016, and having those to refer back to was helpful in some ways. Before I got pregnant with my now youngest, I went to see Professor Catherine Nelson-Piercy, who is the don of hyperemesis and obstetric medicine. She works at St Thomas's, and she's a fantastic advocate for people with HG. And I went to see her because I wanted a written plan before I got pregnant again, because I knew I'd be coming up against not just doctors. These are my bosses. These are people that if I go up against them, they can make my life very difficult. If I'm saying, you know, the standard of care you're giving isn't very good. So I wanted to make sure I had a written plan that literally said, here's my name. You know what I do. You know how good I am. This is what you need to do for Ria. And that's when I went into hospital during this pregnancy. I took my plan with me and I waved it at them. And I said, you don't even need to think. You just need to read this. She's done it all for you. And they still didn't follow it. I had to self-discharge. And I am an obstetric doctor. I'm more senior than I was first time round. I had to leave that hospital and go to a different hospital because I wasn't getting good care. And if I'm part of the system and had to self-discharge, what is it like for the average person who doesn't have that level of expertise?
Yeah.
I was very lucky that when I went to the second place, where I'd worked before, they did really advocate for me in ways that I'm still finding out about now. I don't think I realized the level of depth that they went to keep me safe, because I didn't understand how unwell I was.
Yeah.
This time around, I knew I felt worse, but they got a pharmacy from the oncology centre, so the centre that treats cancer patients, because cancer patients quite often have very severe nausea related to chemotherapy. And they were working with them to try and come up with different medications to give me. But I didn't realise all the ringing around and all the liaising that was happening with other doctors in other departments to try and keep me safe. So I was very lucky that I had that. But had I stayed at the first hospital, it would have been a constant fight. And I was only there 24 hours and that was exhausting.
Yeah.
So if that's what it's like for me, we need to remember that when we're engaging with people that don't have that level of privilege, how utterly exhausting hyperemesis is, and how that layer of being dismissed and having to fight, it just makes it so much harder than it ever should be.
And I think also dangerous, because, and I always say this when it comes to, any kind of health element within a pregnancy, but particularly with hyperemesis, that actually if you're not taking somebody serious, you're really putting them in danger. And you mentioned about you needed IV fluids. How was that experience for you? So not just kind of getting it because you needed it, but actually the experience of like cannulation, because I know that can sometimes be quite tricky for people with hyperemesis as well. And did you have any difficulties around that? But yeah, so I'd be interested to hear what your experience was like as well in that area.
So initially, the unit that I transferred to had an ambulatory day unit, which was great because I could go in for my fluids and then go home at the end of the day. But I was only well enough to manage that for a couple of weeks. And whilst I could do that, the midwives were generally able to cannulate me. But once I got so unwell that I needed to be admitted, they either had to get the anaesthetist to do it if it was going to stay in, or they had to get the team that use ultrasound, because my veins were just completely shot because I was so dehydrated. And I can just about remember, I found it really difficult to make eye contact when I was in hospital because I felt so unwell. Just moving made me feel sick.
Yeah.
But I can remember hearing them going, she's going to need a line, she's going to need a PICC line, or, we can't put a central line in up here, ha ha ha, but she might need a PICC line because we can't keep doing this. And me just going, that's not good. And by the end of it, actually, I was a bit needle phobic, and I wasn't at the beginning.
Yeah, no, yeah. I don't even know what to say, because I can completely relate to that. I remember in my last pregnancy, people refusing to cannulate me because my arms, people kept trying so much. And then, how melanated skin tends to bruise, it kind of comes up there's a bit of a delay. And so by the time I went back to the hospital again and I needed to be cannulated, the staff were refusing to, and that was actually quite dehumanizing, because it wasn't even done respectfully. It was done in such a way where I'm not touching her. And that just was just such a kind of shock to my system to hear somebody just say that just so coldly. So yeah, I get you, and I completely have a phobia of like any type of test, blood test, cannulation, anything. I want to go to Amanda, actually, because I know, Amanda, you have, you know, kind of said to me that you had quite a different experience of HG, and I'd love to hear about your experience as well.
Yeah, my to be honest with you, I didn't even know I was a HG sufferer. I just kind of like battled. I've had 5 pregnancies and I have 2. So again, you do the math. And I have just battled through my pregnancies and just kind of thought that it was just severe morning sickness. But I kind of had it as a running joke, like it's severe morning sickness. That's all day, every day for 9 months. And that's how I've been through all of, you know, the ones that have progressed. That's how it's been. The 2 that have progressed, it's been all day, every day for 9 months. The others that didn't progress, you know, I think the last 2 were the most severe experiences I've ever had. The last one that didn't progress, and the one before that, she's 6 now, but I could not do, you know, when you talk about debilitating, when you talk about not being able to make eye contact, when you talk about not being bedbound, those are the things that I'd experienced. But with the last one, who's now 6, I kind of just got on with it because that's what you do, because there was not a word for it. I'd never heard of hyperemesis, gravidarum, or HG. So, you know, you couldn't walk and tell your community, your parents, your partner that you've got HG and you can't get up and go to work, or you can't, you know, cook dinner, or you can't feed the family. You just got on with it because it was just part of being pregnant. It's just part of the whole process. But it was when I had the last pregnancy and I was so ill. And I mean, I have, it's just very severe nausea, but it's actually the inability to do anything. I can't get up. I can't get up out of my bed. I can't lift my head off the pillow. I can't eat anything. I can't even drink water. So I'm severely dehydrated. I'm hungry all the time, but there's nothing that I can hold down. And it was actually Sister Rachel here who said, when I told her what I'd been experiencing, said, "Sis, you've got HG." And I was like, "No, I don't. I don't. I'm never vomited because I'm just don't do that in general." She's like, "You don't have to vomit to have HG. Everything you're saying is pointing directly to HG." And that meant I could name it. And then I could go and tell people, "Oh, you know, when you all thought I was lazy or crazy or stupid or just like being dramatic, I actually was suffering silently with a condition that made me not enjoy my pregnancy at all." And it's really emotional to say it. And you know, I've done the birth work and I've done the storytelling and I've done my, you know, my counseling, but it gets me when I remember that I was actually so lonely and I couldn't explain it to anybody. I couldn't tell anybody because I don't know, it's something you can't actually explain. If someone said put it into words, I can't quite explain it. Feels like I'm dying, but I'm not. Feels like I have an alien in my womb, but I don't. Feels like water tastes like sewage water or sewage water. I don't know what sewage water tastes like, but I can just only imagine. That's what anything that was coming into my system tasted like. The way I smelled, the way the room smelled, the way I it's very difficult to describe. Yeah, so that was my experience, and a lot more than that as well, which I'm sure we'll kind of get into afterwards. But yeah, that's mine.
Amanda, you've touched on something really interesting there, because I feel like in many cases with HG, like, people don't get it. I remember hearing about Kate when she had it, and now, you know, everyone around us was just like, you know, why so extra kind of thing. And you just adopt that attitude, right, until it happens to you, and you're like, oh snap, like this is not this is not a joke. But I think in some cases, like when you are visibly, audibly sick, you know, people have to see it or smell it, you know, or whatever, like there's a witness to it. It's more accepted. But in your case, like, there wasn't anything that people could see to believe you. What impact did that have on your relationships with people, or how did people around you what impact did it have on the relationship you had with people?
Wow. You know, Dr. Ria was talking about the issues she experienced in hospital when not being listened to and not being heard. I think actually that can translate into community and family, not because they don't want to listen to you or hear you, but if they can't, if there's, you know, as you were saying, you know, can I get a witness? I can see you're sick, I can hear it. But if you can't see someone sick and you can't hear it, and they're just telling you and they can't even describe the feeling, then the relationships around you become really, really strained. Because people can't quite understand why you can't get out of bed. And especially if you don't know you're pregnant. In my last pregnancy, for 3 months, I didn't know I was pregnant. I just thought I was really ill and I was going to not survive. So it was very difficult, because if I could have then said, oh, it's because I'm pregnant and I suffer like this during my pregnancy, people may have been a little bit more understanding. But because there was nothing that we couldn't, you know, we just couldn't understand what was going on with me, and I felt that I wasn't listened to in my family. I felt that I was a strain on the family, because I wasn't helping anybody, I wasn't supporting, I wasn't being part of the ecosystem of my family. And this was happening during lockdown as well, which is quite fortunate, because I didn't have to do the school run or anything like that. But in one way, it made it even worse, because it was even more isolating, because everything was already going on with lockdown. Then I thought, if I'm pregnant, I'm actually going to have to go through this hyperemesis, and then I'm going to have to go to hospital and have a baby, and I'm a Black woman, and I'm 5 times more likely to die. So there was all these other things that were going on that I just couldn't, you know, it was having a serious impact on my mental health and well-being.
Yeah. Yeah. What was like the conversations like for you with people? How did you feel like, what was the kind of like conversations you were trying to have with people when you basically wasn't being seen?
I think I just stopped talking. I just stopped talking about it, because I just wasn't getting, because I couldn't understand what was going on. I couldn't explain it to anyone. So I just stopped sharing. I think that's what I did. I shut down, basically, because that was the way I felt safest. Because when I tried to talk or explain and no one understood what I was talking about, it made me feel more distressed.
Yeah.
Because you really just want people to listen and hear and understand. And kind of like, when you can't get up, to be saying, don't try and get up, because it's not going to work for you. You know, stay, relax, chill out. But I wasn't getting that, so I just shut down. I stopped talking.
Yeah. No. Yeah. Do you feel like there were any other kind of I guess, like, do you feel like there was any other kind of like stigma attached to having HD in particular as like a Black woman of faith? Like, do you feel like there was an added element there in terms of, you know, your experience as well?
Well, I have a sister circle, because I'm a birth worker and a doula, so I was able to reach out to the sister circle and have this conversation about my feelings. And it makes me feel very emotional to talk about it now, because I just did not want to be pregnant. I didn't want to be pregnant at all. And in the one before this, I definitely wanted to be pregnant. So I was very happy to be pregnant. But, you know, it felt like there was an alien in my stomach. So I kind of joked about it. I was like, but I know that people couldn't understand when I was like, it feels like an alien in my stomach. I don't feel connected to this baby, because it's making me really, really poorly. So I don't know what's going on. But we're kind of like, ha, ha, he, he. But I know people were giving me the side eye, like, why are you saying that? You know, you should be so grateful. You know, my mum's like, you know, alhamdulillah, you know, I'm going to be a grandmother again. It's amazing. It's wonderful. And I'm looking at her and thinking, are you crazy? Can't you see I'm suffering? But she couldn't see I was suffering, because I wasn't doing the things that people would think, you know, she's unwell or she's poorly. But I definitely know that in the last one, I didn't want to be pregnant. I would have taken a baby at the end of it and taken it home and did all the things and breastfed and looked after my new baby. But going through that pregnancy, no, I didn't want to do that. Having the baby and actually having to go through, you know, the whole experience of Black birth, no, I didn't want to do that at all. And I felt terribly guilty about it. I'm a Black Muslim woman. I'm from the Caribbean, so you got the whole kind of Caribbean side of, you know, plentify the earth, you know what I mean? You know, that kind of Christian grandparents kind of like, you know, must go forth and
Be
multiply. You
fruitful
got
and multiply. Yeah.
you understand? And then you got the Muslim side, you know, stuck for Allah. You mustn't have them kind of thoughts in your mind. You must just be very grateful for what Allah has put forward for you. And I was stuck in the middle. I was really struggling in my thought processes. I was really angry because first of all, I just felt I was just too old to be pregnant anyway. No one wants to be the granny in the playground with the you know, the 5-year-old kid. She should be the child's grandmother. Do you know what I mean? But the birth community, the birthing community, the Black birthing community really supported me in how I process my thoughts. And I kind of squared with it. I kind of got with it and thought, you know what, we can do this, which is a shame because I kind of was, you know, I'm a strong Black woman and I've done this before and I can do it again. And I'm going to be very grateful when I have this baby and everything, at the same time going, oh my God, I can't even get out of the bed. I can't even use the toilet. I can't do nothing. But then when I did miscarry, the guilt was overwhelming. I mean, I can't describe how guilty I felt. I just wanted to run away. Because partly I thought, well, that was my fault. You know, I put it out there and then this happened, which it wasn't, because it was a molar pregnancy, but that's another webinar in the future, Natasha. But I felt like it was my fault and I actually just wanted to run away. I didn't want to be around anybody. I didn't want to talk to anybody and I couldn't explain it to anybody. So yeah, it was hard work. It's hard work.
Thank you so much, Amanda, for sharing that, because I know it's not easy to talk about, and I know that I get those feelings with the kind of faith element as well. You know, particularly someone that has been so sick that I have ended a pregnancy because I just felt like I was going to die. I was scared that I was going to die. And then the complexities around faith, religion, you know, like, have I sinned? You know, like, is there any way to come back from this? And then, you know, people who may have known worried about the judgments, you know, within that. And so one of the important things I think for people who are going to watch this from faith communities is to know that we are here for them, and if they ever need, you know, that they know they can confide in, you know, one of us here. But you know, it is complex, and I think also the other side of it is that in our communities there can be a lot of men who are opinionated about women's bodies, and in particular the Black women's bodies. We know this is a huge topic, but even, for example, the controversy with Kanye West at the moment, in that he just feels that, you know, it's, you know, what we see as a right, he wants to have a commentary on what we should do and what access we should have to reproductive health care, right? And so, like, that is really prominent in our community, this kind of judgment that comes with the decisions that we make around our body, particularly as the group that suffers higher health inequalities. And then I feel like hyperemesis is something that's unspoken of and not very well understood within our own community. And so there's layers, and then sometimes you have those kind of intersecting things where you have HD, gestational diabetes or hypertension, or maybe all three, plus some, you know, sickle cell. And so, you know, really people, you know, these conversations are really nuanced, really complex. And so it is very, very challenging. But thank you so much, Amanda. Rachel, I want to come to you about your experience with hyperemesis. I feel free to start where, you know, you feel best, and, you know, what flows for you.
Thank you to everyone that's shared already. I think can relate so much to what's already been said. I think for me, you know, I was the child who went to school, knew what I wanted to do. I had my career laid out, and at the time when I started trying for a baby, I had gotten married, I'd got 2 degrees, I had the car, the mortgage, everything was, according to my parents, was fantastic. I was the good girl. I was the, you know, the person in the family that was an inspiration. And then once I got married, I started trying for a baby, and it didn't happen straight away. And I was thinking, what is going on? There's something wrong? But anyway, when we did fall pregnant, within 6 weeks, I started to feel very sick. Now, I have an auntie that's always said that I'm a hypochondriac. So when I started to be really sick, I automatically started to think, oh, it's just me. And I remember at week 9, we had a family gathering, and I managed to rip myself off the bed and go. And for those that don't know, in many Black communities, African, Caribbean, we don't tell about our pregnancies very early. So in the first 3 months, I tried to keep my pregnancy a secret, but I was just being sick everywhere. So it was impossible to keep it a secret. And I began referring to my pregnancy as a baby, which is quite significant for the story that I'm sharing. So I went to this family gathering, and I was showing, and I was 9 weeks. So, I mean, if you look at the apps and you look at the size of the fruit, really, I shouldn't be showing anything, but I was showing everybody knew I was pregnant. And as they were talking to me, I kept being sick in this car park where we were just gathered as a family. I didn't actually make it into the function because I just kept being sick. And my aunties were like, you just need to go home. So that very week, I became much more poorly. And my sister said to me, no, you're too unwell. And she took me to hospital. Prior to that, I had gone to the GP, and he had said that sickness in pregnancy is normal. So that kind of delayed me doing anything else, because it's meant to be normal. Remember, my auntie said I'm a hypochondriac, so I'm thinking maybe there's just something going on here. So eventually the GP did prescribe me cyclizine. But I didn't take it because I didn't understand why I was taking it, and I didn't have a diagnosis, and I didn't know why I was being given medication in a pregnancy, which I know that in my family, we don't take medication in pregnancy because that's just not what you do. Paracetamol, maybe, drink your water, relax, you're pregnant. So on my 9th week, approaching 10th week, I got very poorly. My sister took me to the hospital, and as they asked me my name, I collapsed on the floor. And it was really just a whirlwind. I got admitted on that visit to hospital, and in that admission, by the 5th day of my admission, I was diagnosed with HG. So that was fantastic to have that diagnosis, because I could name what was happening to me. It wasn't me being a hypochondriac. It wasn't in my head. I very much wanted the pregnancy, and I now knew why I was being so poorly. But unfortunately for me, at that point is when they started to talk about steroids. And I was given steroids because they couldn't control my sickness over a 5-day period, and it was just not letting off. And I was really, really unwell. And then they went to steroids. And the day after I had the steroids, they made a decision that I could go home. And I wasn't too happy with that decision, but, you know, I was listening to what they said anyway. On the night before I went home, I said to them I was feeling some pains. But again, you've been throwing up 30 times, you know, even with all the medication, you're going to be in pain. And the nurses said to me, you know, you may be having pain from all of that. So I accepted that. I mean, I don't know what's going on. Yeah. So I'm just accepting what I'm being told. And I went home, and a few days later, well, the next day after leaving hospital, I unfortunately started to miscarry the baby. And so that was a shock. Was it HG? Was it the steroids? What was it? What did I do? Where did I go wrong? And so immediately I went into a spiral of emotions and feelings around what had just taken place. I really wanted a baby, so I didn't want to hear all this stuff about, you know, God's will. You know, my pastors were coming around. I just was like, I mean, you guys can talk, but I'm not even taking this in. I just need a baby. So as much as I needed to heal and repair from what had just happened, I didn't want to hear it. And I held on to the doctor's feedback that my womb and my cervix and everything was very healthy and lovely. And that's all I heard. Everything else that had happened, I didn't want to acknowledge it. I just wanted to get on with having a baby. So we fell pregnant again. And by the 6th week, I was very sick again. So I continue. I knew this time that it's probably HD, despite people, medical professionals, promising me that I might not get it again. Many people don't get it again, which was the worst thing that you could have said to me. Because when I got it again, I was like, oh man, what's happened? So I got very, very sick again. And I had several admissions throughout my pregnancy. I was in and out of hospital to the point that I knew who was going to be on shift when. I knew everything. I could literally care for myself. I was there when people came in and left and had operations and came back. Like, I was just there all the time. People knew me as soon as I went into the hospital. And it was very, very difficult. So as many of you have already said, so spending lots of time in a room by myself, being sick, not wanting to look at anybody, not wanting to talk to anybody. And when people did come around, I was an act. I was literally doing whatever I could to try and not be sick, listen to the instructions they're giving me. So apparently in Ghana, you can, my parents are from Ghana, my heritage is Ghanaian, you can suck bones and it will help you not being sick. So I'm sucking bones. Then it's lick clay, do this, scratch this, turn this. I was spinning around performing to try and make my situation better, and clutching on any hope from anybody. If you told me to roll on the floor 5 times and it would help, I would do it just to try and help myself and to prevent another admission. And my auntie, who's a midwife, came over and she was saying, Rach, come on, do these things. And she watched me for the next hour and she said, no, I'm not telling you to do anything else. You have been sick more than 10 times in this hour. This is ridiculous. And she just started to educate the family as well as to what was happening to me. On all the different admissions, so many different things happened, and that's the hidden stuff around HD. So you're in hospital for one thing, then something else is going on. The injections, the trying to get cannulas in every single possible cannulated place, and then finding there's none left. And I'm looking at them and they're looking at me and we're like, where are we going to go next? Because there's nowhere left. You're tired financially. My husband was training and then he was doing work self-employed. So that meant if I'm in hospital, for him to be able to come and see me, he has to not be at work. So financially, we was having a hard time. I was not at work either. So I was off sick for a very long time. And it was scary because I knew what happened the first time. So I spent most of the beginning of the pregnancy just hoping to get to the date that when I lost the first pregnancy. And when I got over that, it was like, oh, right, okay, I made it. So then struggling to get through the rest, I would also try and compete with myself that today I don't need to take the medication because I'll be all right, which is the worst thing you can do when you've got HD, because you then allow yourself to get very sick and then start trying to repair it with medication. But because culturally and in my family, we just didn't do that stuff. We just didn't take medication when you're pregnant. No one's ever been here before. So it was just shocking that I was taking 9 tablets a day. So again, I was making myself worse by stopping taking the medication in the regular way that I was supposed to. And by the end of the pregnancy, I had incidents where I had early labor and was rushed into hospital and told that my baby would be delivered prematurely and potentially I won't be able to see the baby. Luckily, they were able to give me some steroids again, and that slowed it down. And then they made a decision to monitor me a bit more. Again, with that monitoring, we then identified that I had obstetric cholestasis. So more monitoring, and then we finally made the decision to induce me. And I can honestly say I was happy that was the plan that we put in place, that I'd be induced. you know, just before 38 weeks, so 37 weeks. And I think one of the interesting things about all of that is with all these different conditions, I was still being sick every single day until the baby came out of my womb. So it was really difficult. But I became the education piece within our community and within the family and within people around me, because they'd never seen it before. And even if they had, being pregnant and suffering is normal. A woman suffering to get to a point of something is deemed as normal. You need to be strong. You need to man up. You need to not man up. You need to like manage and survive it. But actually, this was more than something that I could survive. I was very sick. And then my son, so I did all of that, and then I thought, oh, let me go and do it again. No, my son wasn't actually, we didn't plan to have my son at that time. But I found myself feeling unwell, and again, it was bang on 6 weeks. I was like, there's a pain down the back of my leg. And I said to my friend, do you feel pain? And she was like, well, why would I feel the pain that you're feeling? It was just really random. And then I realized that something's not right. Did a pregnancy test, found out I was pregnant. And within minutes, I just started throwing up. So I then said to myself, this must be in my head. This must be me making this thing up, that making myself sick. But actually what it just was just a coincidence that the symptoms had prompted me to do the test because the sickness was coming. And again, with my son, I was sick until I delivered him, and had more monitoring. But this time I followed the rules and I took my medication. I didn't care what anybody had to say. I didn't care, you know, have faith and all of that. I had faith, but I had to use my brain as well. Yeah. And faith without works is just dead. So I had faith and I prayed and I believed that I would be okay, but I took my medication on time, and me and my husband developed a system so I couldn't change my daughter's nappy, because yeah, that would be me out flat for the day. So he would do certain things before he left for work, and I had literally a care from family. So I would wake up in the morning, take tablets in bed and have something to eat, wake up, get off the bed and be sick. By then my daughter would be up, get her ready, and we'd literally drive 5 minutes up the road, and I'd stay at my cousin's house for the whole day on her sofa with a bucket, and she would look after my daughter. And then when my husband was on the way home, I would have taken medication, and he would either come behind me or pick us up depending on how unwell I was, and then we'd go back home. And we did that every day for the whole time, except from the periods when I was able to work. So it was really difficult, really, really difficult.
Thank you, Rachel. And you know what, I think you've highlighted something really important there, which is partners, like the impact that HG has on partners, and how active partners, how much more active partners have to be in HG pregnancies, or how much more supportive they need to be. And we hope that they are in the HG pregnancies, because you literally, if you've got other children, you know, someone needs to take care of those children, and then that can have a financial impact on the family as well, when they're having to take time off because maybe they've got to take you to appointments, or, you know, they basically start to juggle everything on their own, because as we've kind of identified at the beginning, and smells are triggering you off, like the, you know, normal smells. We're not talking about things that are just strong, you know, your senses change straight away with HG. And like you said, like usually it's my senses that have told me you're pregnant, take a test, not that I've missed a period or anything like that. It's actually like this, a change in the way that you experience normal smells, or, you know, and that can be down to just the natural scent of your partner making you sick, your own scent making you sick, the smell of your house, furniture, everything is so much stronger. And just one question I wanted to ask you, before going to Dr. Caitlin, is how did HG impact your career? Because you spoke about your career and your education. How did that impact your career? That has, knowing that you have HG pregnancies, does that ever make you feel like I'm going to say goodbye to my career, or it, you know, affects how big a family that you actually want? What's the impact been on like your career, and, you know, where you were when you first, you know, had your first child?
Yeah, that's a really great question, and it's a really important thing for us to all observe when we're when we're speaking to somebody who's had HG, because there's twofold. So I would have happily continued being in the career I was. I was a teacher. I didn't want to leave that career, but to be a teacher, you need to be in the classroom, you need to be delivering the lessons. And if you're not doing that, you're not being a teacher. So if you're in hospital for 90% of your 9 months of pregnancy, you can't physically do the role that you trained up to do. And if you're somebody who then thinks that you want to have more children, the fact that you're not going to be able to deliver the role in the way that you know it should be delivered, it has you thinking about, what am I going to do? And some people have some very negative experiences of trying to juggle work and being sick. And because of the lack of awareness of HG, many people don't really know how to continue working with HG. So for me personally, I actually left the profession and I founded Mummy's Day Out, and that's kept me very busy. But would I have done that? Probably not. I probably would have still been in that profession. But the fact that I had I have such difficult pregnancies, I'm more than likely going to have another difficult, like a challenging pregnancy if I was to have one, means that I can't put myself in a position where I will let down make myself feel like I'm letting down a team, or I'm unable to deliver the role that I've signed up to do.
Yeah.
And then when we talk about having more children, so this is something that I every morning I think about this. I wanted 6 children, and everybody thought I was crazy anyway, because 6 children, I mean, what were you thinking? But I really did want 6 children. And I've got a stepdaughter and I've got 2 children. I've got a boy and a girl. And many people say to me, why would you even consider having another child, having been through what you've been through? And what we don't talk about with HG is the severe grieving that you have of the possibility that the decision to have another child has been taken away because of this condition. And it was when I spoke to Caitlin, Dr. Caitlin, about this, that she said to me, you know, if you're gonna have another baby, then you just need to plan like it's a big project. You have to employ the people to do the things, you have to do all that stuff. And even then, that, you know, that's financial and there's a lot of things to do with that. But even then, I felt empowered that I could even have a decision. But then the thought of being sick and being in the room by myself again just shuts all the hope down. And it's so difficult. This weekend, my children were asking me to have a sibling for them. And both me and my husband were in the car, we were all jolly, music was blazing, you know, last, everyone's enjoying. And then the kids were like, Mummy, we want another baby. Daddy, can we have another baby? And we were like, oh yeah. And then we looked at each other and it was like we just got swallowed into a hole, because not only was I impacted, so was he. And so, yeah, the decision to have more children is almost taken out of my hands, which is really sad. And I'm coming to call Ria to ask her, who did you speak to and where do I need to go so that I can even have, you know, explore some of those things. And I went to Pregnancy Sickness Supports Conference and listened to the developments in other countries and the care that's being offered. You know, as a businesswoman now, I'm running 3 different businesses. How would I physically be able to go and stay in a hospital for a drip? I need home care. We don't have that as accessible here. I would need a drip. I know I will, but you know, you had a day, Ria, you're talking about day access. Where would I get that here? And so just thinking about all those things, and so for that reason, yeah, my chances or my choices around having more children have been heavily impacted. My career has been heavily impacted. And I've had to pivot.
Yeah. Thank you so much, Rachel. That you've done fantastically without me having to ask you too many questions, and you really touched on some really important points about thinking about career. And I really just want to say this and get this out there, like, we need to see hyperemesis a lot bigger than medication and treatment. It's about this physical support and practical support that you need, and also employers, like, we need plans for people, you know, sick pay, sick plans, for people that have severe hyperemesis, really understand the impact on that. I live in a rural area, and so the cost of driving to a hospital is astonishing for hyperemesis. The amount of, you know, I know we're supposed to get free prescriptions, but unless someone's actually letting you know in early pregnancy that you should have that, you're paying for those prescriptions. And sometimes, like for me, I remember getting about 4 prescriptions in 1 week because nothing was working. The cyclosine was making me hallucinate. It was making me see weird colors and all sorts of crazy things. And it was like, I'm like, nope, you need to give me something else. And then I needed something for the acid reflux. And then I needed something for this. So even the way that, you know, you're kind of navigating the hair, it costs money. So I do think that it needs more robust input in terms of how we look after people with hyperemesis. Dr. Kelly, you've been so patient, you've been waiting a very long time. So I want to get into some questions about kind of treatment with you. What kind of care should people with HG expect straight away? So like the minute you know, like this is not normal, what type of questions should they be asking? Or what should healthcare professionals be picking up if people are saying, oh, you know, this has happened to me, you know, everything smells really horrible, and, you know, I feel really dizzy, I can't get out of bed. What is the type of care that people should be kind of seeing implemented, you know, at the beginning?
There's a big difference between what people should be getting and what people can currently expect to receive in this country. It is changing, it is improving. My eldest now is nearly 15, and things are improving. We have guidelines and so on. But I mean, it's all so familiar. And I must admit, I know you said I've been waiting a long while. Like, I consider Rhea a friend of mine, and Rachel, and I still find it really hard to listen to people who I care about describe their experiences, even though, I mean, it's what I do day in, day out, you know, and my own career was decimated and I've been through it, and I run pregnancy sickness support, so I hear it all the time. But like, I was almost crying when I'm listening to Rhea, because I consider her a friend, and I find it so hard to listen to, and just that, what I find hard is just how badly she was let down. So anyway, what you should get is that as soon as the symptoms are impacting your ability to function, eat normally, drink normally, you should be starting on sort of first-line medications. We actually even have one that's licensed in this country called Zonvia. So it's licensed for nausea and vomiting of pregnancy. However, to get it is not that easy. It's expensive, and a lot of GPs haven't heard about it. It's not on a lot of formularies for the way they prescribe in different areas for various reasons. I mean, one thing I've heard is things like, oh, but this is a new drug. It's not a new drug. It's been around for decades. It's just now been licensed in the UK, but it's been licensed in Canada, for example, for decades. So that it's frustrating that doesn't happen, because I think there's a big chunk of people who wouldn't get so ill and end up in hospital if they got treatment early on. The cheaper versions of Zonvia is things like cyclosine and promethazine, but as a couple of you have mentioned, that you get reactions to these, so it can be a bit hit and miss. There's various other options with things like ondansetron and metoclopramide, but just getting them it can be really hard, and it can be really hit and miss. And one of the things that we sort of suggest is trying different doctors, and contacting charities like Pregnancy Sickness Support, who can look at if there's a particular GP in your area that we happen to know treats women with this well, and things like that. So but yes, I mean, in theory, what you should be getting is medication to get symptoms under control, medications that have been around for decades, which have mountains of evidence behind them. I mean, ondansetron's now one of the most researched drugs in this field, and you know, as far as the data is concerned, I consider it safe. There's a slight association with an increased risk of oral cleft, which is so minuscule in real terms, that, and actually it's probably more to do with the fact that women taking ondansetron are malnourished and micronutrient deficient, and if you gave all those women ondansetron more readily, we would probably see a decrease in the incidence of oral cleft in that population. But the data has been slightly misinterpreted by our European Medicine Agency. Well, not slightly misinterpreted, completely and utterly just used in the most appalling way, which we've had Ria's aware of the long fight we've had with them trying to get them to change it. But so that's what you should get. If you're dehydrated, you should be getting fluids. My dream is one day that will happen at home for the vast majority of women. It wouldn't be suitable for all women. And I think we talked about the fact that, you know, because of other health conditions and stuff, if you have high blood pressure, for example, you probably would never be suitable to have IV fluids at home in that circumstance. So there's always going to be a place for actually needing to manage it in hospital. But access to hospital shouldn't be so hard. God, I had to fight tooth and nail to get into hospital. And then when I came out, my GP, who I'd worked professionally with as a practice nurse, told me I just needed to pull myself together. And, you know, so it just, yeah, it shouldn't be as hard as it is, but it is hard. And, you know, vitamins and all this other stuff should be being looked at.
I wanted to also ask, so I think that's largely covered in, you've kind of covered like tablets, for example, but for me, I could not keep down tablets. And so some medication had to be injected, which wasn't a pleasant experience because you can only have it injected in certain places. So could you speak to that as well? Because I think that a lot of the time, unless you're in the know, I had a peer supporter, but I think actually at that point for them, they were like, she just is not keeping this stuff down. You know, we need to give her something else. And that actually was the only time I had relief, when I was having injections, having my medication injected. So could you speak to like other ways of getting the medication as well?
So interestingly, in the UK, we generally are very, we don't like putting things up our bottoms. which is kind of bizarre, that we're so sort of funny about this in the UK. But in a lot of Europe and a lot of other countries, if you're vomiting, they don't even attempt to give you oral medication because you're vomiting. That's the point. So in a lot of European countries, they give it per rectum. So it's a tablet that you can do it yourself. You pop it up your bottom. Now, I mean, you know, once you're pregnant and things like piles and stuff come in, I mean, most of us become quite used to dealing with bottoms, and you've got babies pooing everywhere and all the rest. You know, it's not that big a deal. But in the UK, we're sort of funny about it, and so as a result, it can be very hard to even get hold of suppository medication. Suppositories where it goes up the back passage. So and there has been manufacturing issues as well, and I don't know whether it's a Brexit thing or a what thing, but at the moment, I don't think you can even get most of the medications as suppositories in the UK. You can in other countries. But as a result, you know, injections and other things are an option. Some meds can come. So there's one called prochlorperazine, which you can take as a tablet, called Stemetil, but you can also put it up in your gum. And ondansetron also comes as melts, but it's very expensive. But I mean, not compared to a hospital admission or, you know, all the other things. I mean, you know, it's still very cost effective. And if you had some other condition with more empathy around it, they wouldn't bat an eyelid at giving you vastly expensive medications. I mean, even if it was that you needed IVF in order to conceive, you could have a round of that on the NHS in a lot of places. Well, why can we not use a similar amount of money to provide melt ondansetron or suppository ondansetron? So there's a bit of a, you know, this condition doesn't warrant doctors using their prescribing budgets for or something. So, but that's all stigma and bias. So injections are an option in some countries. They mostly in America, where they tend to be they're quite into intervention, in slightly more so than us here. And they, for example, there's been cases of women using syringe drivers where it's given like under the skin slowly over 24 hours. Now, they use these a lot within cancer treatment and palliative care. But they aren't really used in hyperemesis. And I think that's a bit of a shame, because I think it's quite effective. I think the other problem with taking oral medication when you have a vomiting condition is that you've got an empty stomach, and you're not really managing to keep fluids. You possibly aren't actually like absorbing the medication correctly. You're dehydrated, your blood, you know, all of that stuff. So you're getting peaks and troughs of the effectiveness of the medications. Whereas if you can give it more stably, like with suppositories and injections and IV, then potentially you keep that blood level more stable and get a better relief of symptoms over the 24 hours. But the bottom line is there's just no research on this. I mean, there aren't any papers written up of proper research papers written up where they've used a syringe driver for a woman with hyperemesis. Not one. So we need the research to kind of back this up, because otherwise, you know, when I suggest this to doctors, they look at me like I'm completely bonkers. Why would we do that on a pregnant woman? Well, because she's very seriously ill, and you know, so there are other options, but getting them is not necessarily that easy. Again, injections, I don't see why. If you're going through IVF, you and your partner are trained to give you IM injections as part of that process. Why could my husband not be taught to give me an IM injection when I was particularly bad, in order to prevent me going into hospital? I mean, we've got a farm. He injects our cows. He could totally have given me an injection, and it would have prevented hospital admissions. Because once you're in that spiral, it's impossible to kind of get out of it with oral medication.
This is true.
So.
And I wanted to just add that I the last pregnancy before last, I had it during the lockdown and during you know, one of the most tumultuous kind of periods within the NHS during that time, and I was just left for hours on my own, and so for me there was also this element of like having hyperemesis during a crisis. And us not really being ready to look after people during a crisis, during a time of great shortages as well. And so I think that there's an added layer of like you said, like not only do we need more research, but we actually need more options, because you know, having to have, you know, a situation where someone's left alone for hours and hours, and during that time you couldn't have partners in. So not only was I kind of left without a partner who could keep an eye on me in case I, you know, deteriorated quite quickly, there was just no staff. There was no staff at all. And so I do think that, you know, as you're saying, like, you know, if in other areas people are using syringes, or, you know, there's other medications that have to be administered in particular ways, you know, diabetics, they use needles, you know, and so it's like, why are we not using more, looking into more resources to support people with HD? Ria, do you want to say something? Please go ahead.
Because fundamentally, we still don't believe women. We don't trust women, and we don't believe them when they say how bad it is, because we haven't pinned down the exact cause of hyperemesis. We're getting there, and we're unpicking and discovering genes that are associated with it. Like there's a gene called GDF15. But until we can say X causes this, women are always going to be to blame for this. And that's from medical professionals, that's from within community groups. You know, there's sometimes a lot of criticism of community groups going, they have their faiths and they all think like this. But hold on a minute, I went to the big shiny hospital last week, and those people with those shiny degrees told me that I needed to be happy about my baby as well. So if it's so indoctrinated within the medical profession that there's a level of hysteria that, you know, unless women can prove what's wrong with them, and unless you've got three lots of ketones, the amount of times I was asked to do a urine sample so they could test my ketones in this pregnancy last year, and they knew me, they knew what I did for a living, and I was just like, no, one, I can't do a wee. You know why I'm here, right? Two, we all know that ketones don't measure dehydration. You know this. I'm not going to keep playing this game anymore. And I guess that's one thing that the job did give me, privilege to just go, I'm not doing that anymore. So that needs to change. We at medical school, as future doctors, we are taught that pain is whatever the patient says it is. There isn't one way to measure pain. We all experience it subjectively. But with hyperemesis, you know, I hear the way that my colleagues talk about it. I hear the way that some of the senior consultants that I've worked under will go, I'm not going to go and see her. Send the F1, which is the lowest grade doctor, send them to see her because she's just a hyperemesis. It's, women aren't stupid. They see the way that you talk to them. They see how you interact with them and the energy that you're bringing into a very vulnerable space at a very, very vulnerable time in people's lives. Yeah. It really matters and it really makes a difference. And the last thing I'm going to say, sorry, and then I'll shut up. The impact of sitting here in a space like this, where you can talk to people that get it. Everybody here is giving up their time because they want to make it better. Despite the hideous times that we've been through, we've all had hyperemesis. We've all experienced pregnancy loss as well. We've had the cultural biases. We've made sacrifices in our careers, in our own families. I barely saw my eldest last year. He was raised by everybody else just to try and keep me together. Sitting in a space like this is really important. And last year I went to Caitlin's ceremony where she got her PhD and where her evidence was discussed. And I had hyperemesis at the time and I felt so unwell, but I just had to be there because in 2017, the year after I'd had my eldest, Caitlin gave me a space to speak about my experience with hyperemesis at the international colloquium. And if I hadn't been able to do that, it really helped me to validate how I felt and to talk to professionals and to be able to go back into the workspace and feel positive that I had something to give back. So then being able to go, you know what, I feel like shit, but I'd be feeling so much worse if I hadn't had that safe space. So being able to watch Caitlin continue to progress her career and become a doctor of something that I couldn't do it. I can't talk about hyperemesis all the time. I have to be able to dial in and out because I find it too much. And I find it very hard to talk about the emotional aspects. So often when I talk about it, I almost sound cold and I talk about it on quite a clinical level. Because if I have to talk about the fact that my husband used to carry me to the bathroom and sometimes I just tell him to leave me there because it was easier. And when we looked around houses, when we were trying to buy a house, I wouldn't look at any houses that didn't have a bathroom downstairs because I knew I wouldn't be able to run upstairs to go to a toilet in time. And that I can't look at a jug the same way. There was a jug that we had to get rid of because, you know, the psychological impact that never really goes away, the grieving that we do internally for the family, the size of the family that never, there's not many spaces where I can say that, where people would just get it, both on the emotional level and the cultural level. So this space is really important. So thank you. I'm going to shut up now before I cry.
I think Dr. Caitlin, you had your hand up, then Rachel, then Amanda, and just go in that order.
No, it's fine. Rachel, go.
Thank you. Oh, yeah. Gosh, I feel everything. I'm just holding back all the emotions. And I think what I wanted to say was, so when you have the baby and the HD stops, so you stop being sick, it doesn't end, but all the care ends. So no one's talking about it anymore. No one's talking about, you know, you just spent 9 months in a dark room in next to nothing closed. You've wet yourself probably 15 times in public and took less of the ones that you've done in private. You've lost out on the development of your child because you couldn't be there because you were busy being sick. You've missed weddings, funerals, just all of that stuff just gets stopped. No one talks about all of that stuff because now the baby's here and you're so happy to have your baby. You're so happy to not being sick and everybody's just getting on with life. but then something's still in the back of your head. And it was so interesting with my experience that I didn't even know that I had a birth trauma. I didn't know that it was called birth trauma, first of all. And I didn't know that I had a negative delivery experience. So I was treated negatively in my delivery experience. I didn't know because I was too busy trying to be overjoyed that I'm not being sick. So it was only after, when I started listening to other things, I realized, hold on, that was not the care I was supposed to have in the delivery. Thank God I'm alive, thank God baby's okay, but actually something didn't go right in that delivery and it was negative experience, but I didn't have any capacity to think about it. So I was thinking about not being sick. And with my son, interestingly, I didn't start exhibiting the impact of HG until a year after his birth. So I didn't realize what it was. I knew that I was overprotective. So I would think that something could happen to him when he's in the care of my mum, for example. And I think, oh, maybe he'd get hurt, or I'd call her and answer silly questions, calling my mum who raised us and looked after us so well. I'd be calling her and answering, have you fed them? And are they not hungry? And she'll be like, are you okay? Can you get off my phone? Because she just couldn't understand why I was behaving in that way. But after a year, and seeing how much I was panicking. If I had to talk about leaving him, I would panic. I'd go into the physical, experience. And that's when I realized I was exhibiting PTSD after having HD, 3 times. And I knew the words and the language to explain it. And I sought help and I got some therapy for it. And to be honest, I think I will continuously have therapy, because there are so many things that happen on a day-to-day basis that I can link to my HD experience. So this week on Monday, I was sick. I threw up just randomly. I was just like, what is this? But I was debilitated. I had to lay in my bed for 5-6 hours because that one experience of being sick on Monday afternoon, probably I just ate something or smelt something. I now couldn't move. I can link that back to HG. There's certain foods I won't eat. My relationship with food, and I learned this at Caitlin's event the other day, where we were talking about how we now respond to food having had HG. And I was thinking, I'm always thinking about, so what am I going to eat? And am I going to be full up? And am I going to be hungry? And if I eat this, is it going to make me feel sick? And even to the point that my friends, we go out and they say, don't touch that. It's not going to be good for you. I've almost developed like a phobia of certain foods. Food is an issue. I'm always thinking about what I'm going to eat. I know that if I eat McDonald's, I'll be full up. If I eat the same meal with the same sauce, I'll be fine. That's ridiculous. I can't always eat McDonald's. But that's how deep HG can impact you for the rest of your life. You survive. Yeah, you do. But it's very, very difficult to move past.
I think, Rachel, when we had a conversation the other day, I think I asked you 2 questions. I asked you about phantom HG symptoms or pregnancies. So like, do you, for example, at the same time of year or similar time of year, have like these symptoms? Because I get that. And I actually had it just recently, because my last one was this time last year. And everything smelled in the house like I was pregnant. I'm like, is this, I'm due one in a few days, so I'm gonna know anyway. But I was really frightened. I was really, really frightened. But also in addition to the kind of phantom pregnancy or the phantom HG symptoms, like you said, like in terms of not getting over it, is the disordered eating that can happen as a result. And I think a lot of people don't really understand the impact of that and the kind of knock-on effect it can have on your actual health in terms of your risk factors for things like diabetes and gestational diabetes later on, because you are consumed with what you're going to eat when you have hyperemesis, because you try so much. We have literally got crisp here because I had to try so many different types of crisps. So not just like the Walker's typical ones, but like ones that were like puffs and ones that were like skips, that can melt in your mouth. And you're always looking for food options, something different. you know, something salty, something sweet, something fizzy, something flat. You know, it's you can't see on this roller coaster with food. And actually, yeah, we don't talk about disordered eating and the effects that can have one person. And usually these are kind of like hearsay conversations, so they're not something you can go online and you're going to find information on why am I eating funny, or why have I gained weight, or why is my weight off, or, you know, why am I struggling with this, why am I always thinking about food and HG. You're not going to find that online. That's only something that you're going to have when you start talking to people who have experienced it, or like these webinars that we're having now. So, you know, I can really relate to that, and definitely it's been a part of my experience too, so you're not alone in that. I don't know who wants to go next.
I think one of the things that we don't talk about, and especially in the Black community or the religious community, is the impact that it has on your relationship, your intimacy with your partner. After you've experienced hyperemesis and a pregnancy that you really didn't enjoy, it can be really difficult to get back into the intimacy levels of your relationship, because the fear of pregnancy overwhelms every part of the conversations that you have. And obviously in some communities, you know, we don't use contraception, or that's not a conversation we have. Or when you get to a certain age, you don't want to use certain contraceptions because they're not good for you. So you might have to think about, you know, the back in the day contraception, you got to put a cover on it. And some of our partners are just not into that. So it kind of brings up a lot of issues around sex, intimacy, what we think is love in relationships, because women are so fearful of becoming pregnant again and love that again, and the men just don't understand it. It's really difficult, and I think there needs to be conversations in the community, a bit more open, in terms of having circles like this where women can talk to other women about that, and men can talk to men who may have an understanding of what that's like, because they'd, as you said, Dr. Ria, it's about a woman's experience, and we're not believed, and hyperemesis is something that it's very hard to explain. I mean, when I tried to say to people, when I was lying in bed and watching my family living their life and doing everything, I felt like I was watching a television program, like I wasn't actually part of it. I felt like I was, you know, everybody talks about that feeling of being disembodied. Well, yeah, because I wasn't participating, I was watching. I felt like I was in a, you know, when you have that camera that looks like it's round, like a, I don't know, like one of them hip hop videos. I felt like I was living in that sort of round thing, and everyone else was living their normal life. So we need these spaces where we can have these conversations, because talking about it is really, really important. And I think it has that impact on your relationship for the rest of the relationship. And it doesn't, as you said, Rachel, it doesn't go away. It does have, it kind of rears its head at certain times of the year, because it's like a muscle memory. So you start having those feelings and those fears come up. And sometimes if you have a little bit of a touch of something, you're like, oh my God, am I pregnant? Am I pregnant? You know, probably nothing even exciting happened, but in your mind, the first thing you do is fear the possibility of getting pregnant. Well, no, that's definitely my experience. So yeah, thank you for this, Natasha, and thank you, ladies, because this has been highly emotional but really important, and it's been a great space for me to be able to talk about this where I can't talk about it in other spaces. And I'll be inviting you guys to come and talk to the women in our group about this as well, because it's really needed.
Thank you, Amanda. Dr. Caitlin.
Yeah, I just wanted to add that actually we've come across a number of cases where actually the man has been scared to have sex with his wife because he's so terrified of getting her pregnant, because he thought she was going to die. So it's not uncommon for it to interfere with relationships like that. I personally got sterilized 5 years ago because the idea of getting pregnant was just ruining so much of my life. And you know, and even after that, it took another year or so to trust that the sterilization had worked and I could now have sex without getting pregnant. And then that was then very liberating. But I do realize that's not always an option. We do a lot of work with women from the Orthodox Jewish community, and they're very limited with what contraceptions they're sort of able to use, and there isn't any research on it yet, but there is possibly within their community, they think the women that are more prone to hyperemesis or more struggle with taking the oral pill, which is one of the only contraceptions they can use. And so although there isn't research to support that yet, you know, it does seem to be a problem that a lot of them don't seem to be able to get on well with the pill. So in that case, sometimes they have been able to go to their kind of religious leaders and get sort of special circumstances that they're allowed to use other types of contraceptives, because it's such a big deal, and it's so sort of life-threatening to just keep getting hyperemesis. But yeah, I mean, within each community there's different challenges like that, and certainly, you know, I know men who have been absolutely terrified of getting their wife pregnant. And yeah, we've all kind of had that fear. Interestingly, this muscle memory thing, I just realized that this morning I was driving to work and I needed to send an email in the car, and I pulled over into a lay-by, which I don't think I've pulled over into that lay-by for many years, and it was one that I used to regularly. That was the point where we reached in the car where I would start vomiting, and it was on the way to the hospital. And I pulled over in it this morning. I mean, this is we're talking. This was in my first pregnancy, like 15 years ago. And I sort of pulled over, and then I realised where I was, and I sort of shuddered and got this wave of nausea.
Yeah.
And I'd sort of forgotten about that until we were just talking about that then. But that was like this morning, and that's 15 years on. And I mean, I work in this day in, day out. I've written books on it. I've written thesis on it, and I still get that. Still get that.
I have a house that I used to stop in front of. I don't know what they thought I was doing with the bag over my face, but I have that out, and every time I go near there, the same thing happens. I just think, oh, quick, go past, quick. Can you make it past without being sick? It's a long journey to healing.
Yeah. I do have two last questions, Dr. Caitlin. One that's around the gene. So I know that a lot of people just talk about kind of the rise in hormones in pregnancy are related to there, but do you know much about the research that's been done where they're talking about actually like it's a genetic there's a genetic link? Because I know that there was like the sick film which I have watched, but I don't know if you can speak to anything on that at all.
Yeah, so I'm not a geneticist, so, you know, crazy on me on this. But I mean, the bottom line is that there does appear to be a gene, which the gene and the protein have the same name, GDF15. And women with hyperemesis, what we do know is it's not really to do with the extra pregnancy hormones. I mean, if you have extra pregnancy hormones because you've got twins or a molar pregnancy, then you're likely to get higher levels of nausea and vomiting. But that's a bit different to having hyperemesis just because you get hyperemesis. And so with the GDF15 thing, it's basically you produce it at the placenta. Rhea, by all means correct me if I'm wrong on any of this. It's something that's produced at the placenta. It's a normal part of pregnancy. Everyone's going to produce it while they're pregnant, but women with hyperemesis seem not only to have more of it, but the way the receptors to it in the brain, the way they react to it is more extreme. So the reason that's exciting is because it's the same thing that causes there's a sort of an anorexia of cancer called cancer cachexia, and actually like 25% of cancer deaths are because of that rather than the actual cancer itself, where basically they get nausea and vomiting, loss of appetite, muscle wastage, they just lose all their weight. It's anorexia, really. They just can't eat and drink and stuff. And that seems to be the same thing. So tumors that produce more GDF15 than others, you get more of this cancer cachexia. Because there's a link with cancer, it means that there's actually quite a lot of money going into, because no one's interested in spending money on trying to fix hyperemesis, but lots of people are interested in trying to fix cancer-related things. So there's two things that are being explored. One is turning off the receptors to it, which wouldn't interfere with the pregnancy at all. And the other thing is to look at reducing the circulating blood levels of it. Now, these are very early days. These are not in, sadly, not in any of your reproductive life chances, really. I mean, you know, I'm guessing you're all over 30. I don't really know, but I'm 41, and I've already said I was sterilised 5 years ago, and now I'm on HRT for menopause. So, you know, it's not going to be in the next 10 years. But I'm hoping that by the time my daughter wants to have children, that maybe things might be improving by that stage, because it is hereditary, and although she may not get it, she does have a much higher chance of suffering with it because I did. And actually, interestingly, you might want to let people within your own communities know, in the UK we are doing a bioresource study to try and find out more about this gene and pin it down. And actually, one of the things is that we do need more ethnic diversity, because predominantly research in Hyperemesis has been dominated by participants from white, middle-class, educated backgrounds, which is obviously not representative of the population at all. And we really, even within the genetic studies, we just don't have evidence from sort of more diverse communities. So by all means, please get involved with it. All it involves is giving a blood sample, and sort of consenting to it, and then giving some history about whether you had excessive salivation and things like that. To be eligible, you have to have had it at least either more than once, and you have to have had second-line medication like ondansetron and still had symptoms. So there's some criteria, because we're trying to identify like the people who have most likely got the genetic cause of it. So by all means, please get involved with that. At the conference, I gave blood, and I was like, you know, and Rachel did too. So, you know, we need to do that. And there's a lot of other work going on around the world. So, for example, at the moment, we're teaming up with a team in Uganda, because over there, obviously, a large percentage of the pregnant population have things like HIV. Now, HIV is managed almost entirely with, with oral medication. It's oral medication they have to take, and they have to take it at around the same time every day, because if you even miss it by a few hours, you end up with those drugs becoming resistant and so on. And then the viral load goes up. So actually they're starting to take it a lot more seriously over there, because if you're vomiting in pregnancy and therefore can't take down your medication for your other conditions,
yeah,
that's like, it's just amazing that that's not a thing here. I mean, you know, women with epilepsy and diabetes and psychiatric disorders and all of these other things are still, you know, it's like, oh, well, you're just pregnant. And the other thing is that we're so obsessed in this country with fetuses. Yeah, and it's like, but if you managed her sickness, then her epilepsy wouldn't be getting out of control, or her diabetes wouldn't be getting out of control. So it's, yeah, and we're so sort of, people are so obsessed with fetuses and fetal health, and yet in this country we're happy to let women starve, literally starve in pregnancy. We recognize that malnutrition is a major problem in developing countries, and yet in the UK we're told, oh, it's fine to be starving in pregnancy, your baby takes what you need, and if you're even slightly overweight before pregnancy, it's considered a good thing.
Yeah.
So I mean, it's just appalling, but we're getting there though. We're fighting. We're going to keep fighting, right?
And you've actually hit on the next question, which was like, okay, do we need to bust this myth or this kind of what's the phrase I'm looking for? Can't think of it. But the idea that, for example, HD equals healthy mom, healthy baby, because when I see people with HD and I see those sufferers, a lot actually people go into multiple organ failure. A lot of people, there's a lot of stress on their kidneys and other organs, and simply, like, I remember saying to my GP and just sent him screenshots of what I was vomiting, because I'm like, this is not even food right now, this is just like what is supposed to be protecting blood. Yeah, it was just basically blood, and he was just like, you need to go A&E. But before that, like, until the pictures were there, until there was like the evidence there, and I'll say my throat is on fire, my mouth is on fire. Anyone that had called me during that time was like, have you got COVID? Because I just sounded, you know, completely bunged up, my throat was like hoarse. So can we kind of like clarify, is, you know, pregnancy sickness a sign of a healthy mum and a healthy baby?
Not when it's an abnormal condition like this, but I let Rhea answer this one.
Sorry, it just triggered a memory for me, and Caitlin's already heard this, but quickly, as an aside, we know that people with hyperemesis unfortunately still lose pregnancies. So telling someone that because they're being sick, their baby is okay, nobody knows that. There is absolutely no guarantee of that. And there's also more understanding research coming out about micronutrient deficiency and the impact of that on a developing fetus. I went to Southampton University, and they have a centre there that studies the developmental origins of health and disease, with an understanding that if a fetus is suboptimally grown during a pregnancy, that the impacts of that you can see decades later in that adult. So just because you're giving a screaming baby at the end that might have a normal weight doesn't mean that there's nothing that could have been done better to optimize that baby's life chances as they become an adult. And what about that person? You know, women are just seen as gestators for babies, but what about the impact that it's having on their bodies? And yeah, sorry, Caitlin has heard this before, but when I was in hospital last year, one of the things that really annoyed me was that people kept coming to do my obs every half an hour, and I just couldn't get any rest. I was absolutely exhausted. Yeah. I couldn't function, I couldn't speak. I didn't want to have my blood pressure done every 30 minutes and my temperature and everything else. When my friend came in to see me, the consultant who was looking after me was a friend of mine, and I said, can you just tell everyone to leave me alone, please? They don't need to do my obs every half an hour. Why are they coming? And she just looked at me and she went, Ria, you're really unwell, and they have to come in every half an hour because your obs aren't normal. And I was like, yeah, but I've just got hyperemesis and you're giving me fluids, so we know that my blood pressure is going to be low. And she's like, Ria, your kidneys are not working properly. It's not just a little bit of dehydration. You were running on empty, and the steroids haven't worked like we thought they were going to work. And she was trying to give me warning shots to say, I don't know what's going to happen if the steroids don't start working. But I was so unwell that I couldn't see what she was saying. So this idea that you're fine at the end, because as soon as you push the baby out, your symptoms go away and everything goes back to normal, that just isn't true. We know that the body keeps score, if not your baby's body, your body, and actually both. And I think the more that we research the impact, the more that we will see the damage that people are carrying long term. We're already beginning to understand the impact of PTSD. Each one of us has a story about something that we can't eat or a place that evokes certain memories. So we know that our body is probably doing the same thing. We just don't understand how it's manifesting.
Definitely. Thank you, Ria. Yeah, Rachel.
And do you know something you just said, just reminded me of a thought I had the other day, especially after the conference, which was, I need to do everything in my power to not let my daughter have to really go through this. And I thought about it after the conference. I was thinking, God forbid my daughter did have hyperemesis. Would I even be able to support her properly? Because I'll be triggered. She'll be going through what she's going through. And then to think now, the thought of having a child, and when I was pregnant with my son, my daughter was 2, and she used to tell anybody that was looking after her, my mummy does this, bleh, bleh. So she was a baby, so she would reenact what she was seeing. And you have to consider all of that, the fact that they're going to have to see all of that stuff. It's just a lot. It's just a lot. But the want and the desire for another child kind of, I don't know if it has a battle with it, or if it just it doesn't suppress it. It doesn't go away. It is a lot, and I hope that anyone that's watched this and is listening in can hear the journey, like mentally even, that we've been on, but also the physical experience and the challenges in all the different things. So with medicine, with family, with community, with, you know, professionals, it is very, very difficult. And hopefully with the research that everybody's trying to do, and the groups that are, you know, Pregnancy Sickness Support, and any other groups that are forming to support women and families who've had HD, I hope that we raise awareness, but also provide that support. Even this conversation tonight, for us, those of us that have experienced it, it is a form of support, because you just want to talk. I talk to every single person possible about HD. Like, milkman, yep. Do you know that I had HD? Do you know what it is? I'll tell anybody just maybe they might meet someone on their journey who has HD, and they can tell that person, this is not normal, you need to go and get help. And don't offer anybody ginger biscuits at all. Forget it. Don't do that.
Yeah, that just burnt my stomach, the last little bit I had left. But I do want to say thank you to everyone. I don't know if was there any last comments that anyone wants to make? I'm just really grateful for your time. You've given quite a lot of your time this evening. So I do want to say thank you so much, everyone, for just speaking so honestly and openly about your experiences. Thank you for the advice that's been shared today. Thank you so much to our doctors here who are sharing the information. And we want to just encourage anyone who is supporting someone or anyone who is experiencing a HD pregnancy to seek help. It is something that needs to be treated. It isn't something that you can just sail through and think that everything will be okay. Do seek help. Do speak to some peer supporting organisations. Talk to your GP. If that GP is no good, as has been advised today, try a different doctor and keep trying until you get the results that you need. And as you know, we're here as well. We also have some resources that were created by the Safer Beginnings in conjunction with the Safer Beginnings project with Best Beginners and White Ribbon Alliance. So there will be some help sheets that will have lots of information on there around hyperemesis as well. So as soon as that's available, that will be on our social media. And I'll also be posting all the organisations and any useful links mentioned here today on our social media as well, so that people can give blood or find out more about the research being done. So once again, thank you everybody, and I wish you a lovely evening.